Wellness Rhythm Show. Find your rhythm. Live your wellness.
Y'all, quick question. When you think about your immune system, what comes to mind? Vitamin C? Zinc? Maybe that elderberry syrup you panic bought during flu season?
Right, and most people would not immediately think muscle, but that is exactly where we're going today.
Here's the thing, though. Muscle isn't just about looking strong or lifting heavy things. Researchers are now calling it an endocrine organ, meaning it actually secretes compounds that talk directly to your immune system.
And this is not fringe science. This is showing up in journals like Nature Reviews, Immunology, and Cell Metabolism. The phrase some researchers are using is muscle as medicine, and it earns that title.
So today we are unpacking why building and maintaining muscle might be one of the most powerful things you can do for your long-term immune resilience, and what that actually looks like in real life.
Especially if you are in your 30s, 40s, 50s, or beyond, where the stakes on this topic get considerably higher.
Let's start with the basics, because I think a lot of people hear strength training and picture a 22-year-old at a gym with a protein shake and a very specific playlist.
Which is a reasonable assumption, but a limiting one. Strength training, at its core, is simply applying resistance to your muscles to stimulate adaptation. That can be bodyweight, bands, dumbbells, a barbell, or machines.
And I will fully admit, I have started and abandoned this exact thing approximately 4 times. So I am coming at this as someone who genuinely needs to understand why it matters before I can sustain the how.
That is actually the right order. And the why here is genuinely compelling. When muscle contracts during exercise, it releases signaling proteins called myokines. Researchers like Dr. Bente Klarlund Pedersen at the University of Copenhagen have been studying these for over 2 decades.
Myokines. Say that again for the people in the back.
Myokines, and the most studied one is interleukin-6 or IL-6. In the context of exercise, Illinois, 6 has anti-inflammatory effects and helps coordinate immune cell activity. This is distinct from the chronic low-grade IL-6 you see in metabolic disease. Context matters enormously here.
So the same compound can be inflammatory in one setting and anti-inflammatory in another?
Exactly right. Exercise-induced IL-6 is a short-term burst that signals the immune system to respond appropriately, then resolve. It is the chronic resting elevation that causes problems. The muscle is essentially sending a beneficial instruction rather than a distress signal.
That is a genuinely useful distinction and one I had never heard explained that way. Okay, so beyond myokines, what else is happening?
Right, let's unpack another piece. Muscle tissue is one of the body's primary glucose disposal sites. When muscle mass declines, a process called sarcopenia that begins as early as your mid-30s, insulin sensitivity drops and you get elevated blood sugar over time. And chronic elevated blood sugar is directly immunosuppressive.
So losing muscle quietly degrades your immune function even if you feel fine?
Precisely. And this is the silent timeline that makes this topic urgent. Most people do not notice sarcopenia until they are significantly compromised. Research published in the Journal of Cachexia, Sarcopenia and Muscle estimates we lose 3 to 8% of muscle mass per decade after 30, accelerating sharply after 50.
Y'all, let me tell you, I have referenced my pattern of abandoning strength training 4 times on this show. And every time I connected it to motivation or structure, but hearing it framed as biological preparation for something I will face after 50, that changes the feeling of it for me.
And it should, because there is a compounding benefit here that works in both directions. More muscle means better glucose regulation, better myokine output, better immune surveillance. Less muscle means the opposite of all 3.
Okay, I want to bring in the skepticism angle here because someone is going to say, I walk every day, I do yoga, isn't that enough?
Brilliant point to raise, and I will be honest. Walking and yoga deliver real benefits for cardiovascular health, stress regulation, and mobility, but they do not meaningfully stimulate muscle protein synthesis in the way resistance training does. The threshold matters.
That one stings a little because I have done the same yoga routine for 2 years, and it has genuinely helped my nervous system. But I acknowledged a while back that it has probably stopped building anything structurally new.
Right, and that is not a reason to abandon yoga. It is a reason to add resistance work alongside it. The research does not suggest you need to choose. It suggests you need both categories.
How much resistance training are we actually talking about? Because strength training sounds like a large commitment.
The current evidence is genuinely encouraging here. The American College of Sports Medicine recommends 2 sessions per week for general health maintenance. Studies from McMaster University, led by Dr. Stuart Phillips, show that even lower loads, we are talking body weight or light resistance, produce meaningful hypertrophy and metabolic benefit if taken close to muscular fatigue.
2 sessions a week, that is genuinely manageable. Even for me, and I'm the queen of finding scheduling obstacles.
And those sessions do not need to be long. 20 to 30 minutes of compound movements, squats, hinges, pushes, pulls, covers the major muscle groups efficiently.
Here's the thing, though. Compound movements. Can we translate that for someone who has never set foot in a weight room?
Of course, a squat works your legs and core simultaneously. A hinge, think a deadlift or a hip hinge, works your hamstrings, glutes, and lower back together. A push is a press or push-up. A pull is a row or pull down. 4 movement patterns, trained twice a week. That is the chassis of an effective program.
And I want to flag something for our listeners in the sandwich generation specifically. You may be thinking about aging parents right now, not just yourself. Sarcopenia and immune decline are connected to fall risk, recovery from illness, and hospital readmission rates in older adults.
That is an important bridge. Research from the Tufts Human Nutrition Research Center on Aging links muscle mass directly to recovery speed after infection and surgery. This is not abstract. It has measurable clinical consequences.
So building muscle now is also investment in your future self's ability to recover when something goes wrong, which it eventually will for all of us.
Stated plainly and accurately.
Before we go further, if this episode is making you think differently about what wellness actually means, please do us a favor and hit like and subscribe. It genuinely helps us reach more people who need this kind of conversation.
Right, now, let's address a concern that comes up specifically for women, because I know there is hesitation around the idea of getting bulky from strength training.
Oh, absolutely. I have thought it myself, if I'm being honest.
The physiology here is clear. Women have significantly lower testosterone levels than men, roughly 10 to 20 times lower, which is the primary hormonal driver of significant hypertrophy. The research simply does not support the fear. What women gain is functional strength, improved bone density, and metabolic benefit, not bulk.
And on bone density, this connects directly to immune function again, doesn't it? Because bone marrow is where immune cells are produced.
Exactly right. Resistance training has been shown to stimulate bone remodeling and maintain marrow health, which is directly relevant to immune cell production. Dr. Wendy Court at the University of Colorado has published extensively on this. It is another mechanism linking muscle work to immune resilience.
I also want to address the reality that some listeners may be dealing with chronic pain, mobility limitations, or recovery from injury, because just do strength training can feel dismissive if your body isn't cooperating.
And that is a legitimate nuance. The research consistently shows that even low-load resistance training, appropriate to the individual's capacity, delivers benefit. This is an area where working with a physical therapist or certified trainer who understands your specific limitations is genuinely valuable. The principle is scalable, but the implementation should be personalized.
So the takeaway there is, start where you actually are, not where you think you should be.
Precisely. Progression is the goal, not performance.
Okay, practical integration. What does a realistic week actually look like for someone starting from approximately 0 strength training?
2 sessions per week, non-consecutive days. Session 1, squat pattern and push pattern. Session 2, hinge pattern and pull pattern. 3 to 4 sets of 8 to 12 repetitions each. Use whatever load brings you close to fatigue by the last rep. That is it.
And I would add, for anyone who, like me, does better with accountability, there are apps like Strong Lifts or GZCLP that take the decision-making out of it entirely. You just follow the prescription.
The decision fatigue reduction is underrated as a behavioral factor. The fewer choices you have to make mid-workout, the more likely you are to complete it.
And given that I have identified my barrier as structure rather than motivation, that framing really lands for me. All right. If you are taking one thing from today, let it be this. Muscle is not vanity. It is one of your body's primary immune organs. Building it is not optional maintenance. It is a fundamental investment in your long-term resilience.
And the dose is achievable. 2 sessions per week, compound movements close to fatigue. The research supports this, and the barrier to entry is lower than most people assume.
Y'all, I am genuinely adding a second strength session this week, not starting Monday, this week. That is my public commitment, and you are all witnesses.
Noted. I will hold you to that. And on that note, as ever, start small, be consistent, and do not let perfect be the enemy of actually showing up.
That is the most David sentence ever said, and it is completely right. Thank you so much for spending this time with us. Take care of that muscle, take care of yourselves, and we will see you next time on the Wellness Rhythm Show. This show is part of the VoxCrea.ai system. If you want a show like this for your organization, without building it yourself,
go to voxcrea.ai and request a sample episode.